A mother in their breast milk is making food that human beings cannot digest. But guess who can? Your microbiome.
From birth, you're feeding that microbiome. Hey everyone, welcome back to Heal Your Gut, Save Your Brain. I'm Callie, and I'm here with my husband, Dr. Partha Nandi, gastroenterologist extraordinaire. Woohoo! And today we're talking about Parkinson's. And for any of you that have listened into any of other episodes, it feels like the conditions that we've been talking about in these episodes have affected our lives in multiple different ways. And Parkinson's is no exception. My grandmother had Parkinson's, and we started to really notice a difference in her when she started shuffling her feet. So I think that's a very common.
Well, it took her life. It took her spark. I mean, you know your grandma way better than I do, but this is her grandma, Sally. If you watched, I think we talked about her in another episode, but her grandma Sally was the spark and really
huge personality,
lit up the room, and
a lot of fun.
That's where you light up the room. Just you got that from where you do. You have a big smile. I love it. And I remember the first time I met you, it was like, wow, you just lit up the room, and that was
so nice.
Obviously you're you know I'm biased, but you're a beautiful person, but just the spark, and that's Sally.
Yeah, she was a really, really neat lady with a really big personality. And I think one of the hardest parts about losing people that we love is that the next generations don't get to experience that spirit that those people kind of used to have. And
wisdom that people have. And I write in my book, The Heal Your Gut, Save Your Brain, about one of my patients, Margaret. And Margaret, super kind woman. She saw me for constipation and bloating, and in this episode we'll talk about constipation and bloating, but she saw me for constipation and bloating. Very, very diligent, meaning she always did everything she was supposed to, but she, over the years, I've probably known her for 15 years. In the beginning was mild. First, she had trouble with movement. Then it was, little bit of slurring of speech, and then you start to get the cognitive problems, and just classically what you see in people with Parkinson's disease. And it's devastating. It's devastating. We talked about Alzheimer's. If you were watching the last episode or hearing it, we talked about Alzheimer's, and this is equally devastating. And so first of all, what is Parkinson's? Right? People they know it's a name. What is it? So what is it? What are we talking about? What happens is in Parkinson's, you lose something called dopamine. There's a part of your brain called the substantia nigra that produces dopamine, and you don't have dopamine there. And so when you don't have dopamine, you have a lack of dopamine. That's a substance in the brain that gets you going, like, hey, I want to go do this, right? It gets you moving and gives you the motivation. It also is important for movement, and that's why there's slowness in movement, slowness in speech, and you have that tremor. There's a classic tremor that happens with Parkinson's. So that's why I always tell my patients, if you start to notice, we had a good friend too, and I won't name her name, but both of us, we know her. She's part of a foundation that supports Parkinson's.
Lovely lady.
She had a very slight tremor. Then in my book, I think I talk about Jimmy. Jimmy started with a slight tremor. He ignored it, but this tremor is very classic. So again, in your brain, you're not getting enough dopamine. It results in symptoms of movement, tremor, speech, and then you saw it in Sally too, that you start getting problems with how you're thinking. Your memory starts to go, and you start even getting symptoms of dementia. And so that's Parkinson's. And when you look at patients with Parkinson's, we now know that they have these Lewy bodies, they're called. And Lewy bodies are just clumps of misshapen proteins, alpha-synuclein protein that are misshapen. So that's kind of, in a nutshell, what Lewy bodies are.
And what is this, what you've been talking to me about this gut first hypothesis?
Yeah, we talked about it this morning, right? Before the episode. To me, it's utterly fascinating. So there's a huge connection between the gut and the brain and in general, right? But this one with this disease, it's really fascinating. So I talked about the Lewy bodies and the alpha syncluing, the proteins, and we find it, Callie, in the gut wall. So remember, I talked about the gut wall has one of the most sophisticated neurological symptoms. They call it the second brain. We may even be biased and call it the first brain. But in that second brain are nerve cells in the lining of the gut wall. Think of the gut wall as, like, if you peel an onion, you get those little layers. The gut wall has these layers. They're like tiny, tiny little pieces, right? And one of the layers are the nerve cells. And there's tons and tons of them. In those nerve cells, we've seen the same Lewy bodies, the alphas, including proteins that are there, and they're misshapen. So one of these proteins, when it's misshapen, it actually causes the next one to be, and the next one to be. And we talked about this early on. There's this information superhighway called the vagus nerve, and we now see that it can travel up the vagus nerve into your brain. To me, this is like freak out.
Yeah.
I mean, it's like unbelievable. Can you imagine that something's going from your brain through your nerves into your brain, and that's resulting in Parkinson's? That's the gut first hypothesis. It was a German anatomist, I believe it was Brock. He thought about this. I think it was almost 20 years ago that he talked about this, and now we're seeing evidence of it. And then researchers from Duke actually found out that if you cut the vagus nerve, you stop this progression from the gut to the brain. So what I'm saying is that there's a hypothesis that this thing is traveling up this tiny little minuscule but very long nerve. If you cut that off, you see it stop spreading into your brain. It's unbelievable. So again, to me, what does that all mean? It means that if you now know what you see in Parkinson's and it's in the gut, what happens if you can stop it before it goes up? It's almost like seeing an army. Let's say it's 500 years ago, and you see an army coming to you, right? And they're going to reach into your town in 30 days, and you cut it off at the pass.
Yeah.
They never reach your town. And your town in this case is the brain, and the brain is getting destroyed by this. So the opportunity to stop this devastating disease a decade or maybe more before it comes and destroys your life is an unbelievable discovery. And it gives you an opportunity, again, to be a health hero, to be able to change your gut.
Is that prime time?
It's getting to be prime time. So, you don't have neurologists talking about, hey, by the way, you have Parkinson's, maybe after you have your symptoms, but nobody's saying you have a family history of Parkinson's. What's your gut health like?
Yeah.
And
you're
vice
right.
versa.
We're not really there yet, are we?
Gastroenterologists are not saying, hey, you got constipation. Do you have family history of Parkinson's? Nobody's saying this. Nobody's making the connection yet. Mainstream medicine. Because we know what mainstream medicine is like. If you guys go see a doctor like me, it's like 5 minutes, you're out, right? I mean, it's American medicine's become like this. It's not blaming anybody, but our system is such that I have to spend more time typing about you than talking about you.
Yeah.
I have to more time about checking on your insurance than
many
checking
legalities,
on you.
so many things.
Right? My staff spends more time making sure I get a pre-authorization than to say, how are you doing? So that's American medicine, and eventually it has to change. But right now, you don't have enough time. So people are not making that connection. So I believe that gut health is super important for Parkinson's as much as any other disease state that we have.
But a lot of physicians aren't really there yet. And it doesn't make them wrong. It's just not really part of it.
Not even just that they're not there. They roll their eyes, man.
They think it's
They
woo-woo.
think you're woo-woo, nut job, alert. You're like, it's all in your head, Mrs. Jones. Okay, then where did you see that? Did you see that on the internet? I mean, and they come and see me. They say, my doctor won't even talk to me or listen to me. It says, listen, some of these are my colleagues, and there's some who are believers, but a lot of people are not. And that's part of why we're talking to you.
But it's interesting because leaky gut was not part of medicine and Western medicine teachings until just the last few years.
Correct. And it can happen. What I'm saying is part of the reason why we're doing this, right? We're talking to you because maybe if you hear this and it resonates, you can talk to your doctor and say, hey, we heard, Dr. Nandi and Callie talking about this. What do you think? This is what this is all about. To empower you
And it's
to have
advocating
ideas.
For yourself. Yeah.
Right. And
getting in the driver's seat.
Right. And getting some information. We obviously can't do everything in one show, but we can at least introduce the subject and you can look at it and see if it matters to you. Now back to gut health and how we're talking about how these Lewy bodies are present in the gut. We call it the enteric nervous system, right? Enteric means intestine, nervous system. So then if we can change our gut, we can change it for the better. We now know that the gut of Parkinson's disease has bacteria and bugs that are pro-inflammatory. So you have less bugs like Prevotella, which are beneficial, and more of Enterobacteria. So we know that the ratios of pro-inflammatory bugs, right, are actually more and are more pronounced. And that gives you an opportunity to change the equation, because if you know
you can do something about it.
100%.
Yeah.
And now we're getting, diagnostic tools that now we have tests that tell you, hey, this is what your microbiome is like. This is what you have. So we kind of give this general kind of recommendation: have more fiber, have more prebiotics, and it's all good. But imagine if I can tell you, hey, Corey, you should have more, lettuce or cauliflower. And Callie, you should actually have more kale.
Right.
Kale's not going to help Corey, right? And instead of saying, have kale,
it's
have cauliflower.
customized.
Exactly. Yeah. It's individualized medicine. Yeah. So imagine if you now know that Parkinson's patients have less Prevotella, maybe you can increase their ratio. And ball game, now you have less inflammation. You stop that misshapen protein in its path. That army that's coming, bam, you put a wall, and they're not there. You stop them, and you stop them. A decade later, they don't get Parkinson's. We don't lose a Sally. We don't have a Margaret. We don't have a Jimmy who's diagnosed I think it was his 30s, right?
So what are we going to do? Are we going to do fecal transplants on people to help with this? Is this a future of medicine
It
kind of
can
thing?
be fecal transplants, and not the way we used to do it. But I'm a gastroenterologist. I used to do it with colonoscopies. So I would take the stool of a healthy person, make sure they don't have any infection, and then infuse it directly in the colon. Now we can take pills that take out all of the stuff that you don't want to put in your mouth, and you can actually do a quote unquote fecal transplant. But
Okay,
even
and
more,
what are those then? Those aren't prebiotics, probiotics,
they're
right?
just the probiotics, right? Those are the good bugs they're like
I
packed
just had
full
a
of the
whole
good.
eureka moment.
I know. It's just unbelievable.
It's like a fecal transplant, but in a pill that is commercially available every single place.
Right. And that will
Prebiotic,
that will be
probiotic.
what I think the future is going to hold, because we even know, let me digress to inflammatory bowel disease, Crohn's disease, and ulcerative colitis. We now know if you put the trillion bug army of a healthy person into somebody who has that disease, you change it. You change that disease. Now, we don't have large scale studies rather to show it, but you can change it. So to me, when you know what's going on and what you're lacking, you can replace it. We now have technology. It's beautiful that you can change it. And I think with AI, you're going to be able to map this out for millions of people. Imagine Parkinson's, which is a leading cause of disability and death for people, right? And it's not an easy death either. Not that there are any easy deaths. I'm not saying that we advocate for easy deaths, but it's a miserable existence as you slowly, and my patient, she can barely come to the office, but she still does. And she's amazing. So I think that the future is bright because we have forward-thinking people who look at stuff like, hey, why are Lewy bodies in your intestines? So to me, this is unbelievable. Just it's at the
fascinating research.
It's at the forefront of medicine, but it can be applicable. I love when people talk about like the geek part of medicine, like, all these exciting things are happening. Then you take it back to real life, and what can I do about it? And what you can do about it is change the equation. We'll show you how.
I love it. Let's go back to that Duke study and help me understand a little bit more. That is fascinating.
It is really cool. So I believe it was Dr. Roger Little from Duke who did these preclinical studies in cell cultures in mice. So it's not human, but what they proved was, hey, do these misshapen proteins, these alpha-synuclein proteins actually go from the wall of the gut into the brain? And so they proved that. And then what they did was they cut off the vagus nerve in these animals. And then when they did that, they stopped that transport. So again, there's theory. And now you're saying if it's the superhighway, it's like stopping, I-75 for us, right? Transport so much from here to Florida. Let's say you stop that. and all of a sudden the trucks don't go to Florida. Same thing. These proteins, we're not seeing them transported up. So it is an amazing study to me. Obviously it's not with humans, but it supports our theory when we're seeing that you have these Lewy bodies or the alpha-synuclein proteins, misshapen proteins in the gut. We can see now a reason why, that they're going to the brain via the superhighway. So you think, well, this is great research. What impact can it have? Well, it tells you that you can then make an impact before Parkinson's is in the brain, right? So if you can look at folks and eventually you can find these on electron microscopy. Let's say you do biopsies of some kind and you can find these Lewy bodies or these misshapen proteins. Well, you know that we can now have an intervention to prevent it from going. Because listen, it's one thing to have constipation or bowel movement problems. It's another gigantic step to not be able to move, have tremors, have cognition problems, and have things that my patient Margaret or Jimmy or Sally has. So that's why I think the future, you can take research like this and really apply it to develop techniques, diagnostic techniques and therapeutic techniques to really solve a much bigger problem.
So you talked about constipation a little bit. Talk to us about constipation and Parkinson's. It's kind of this conversation is the first I've heard of it.
It is kind of, it's super, super interesting to me. If you have constipation, your risk of Parkinson's may be 4 times higher just with that symptom alone. And so why? The same stuff we just talked about with the misshapen protein and the Lewy bodies, they're affecting your nervous system. What's constipation, right? Part of that is your bowel not moving appropriately. Well, imagine if you're infiltrating the nerves of the intestine, your bowel movements probably are not going to be normal. So when you see that, and this is the part we're trying to explain to all of you, is if you see that, hey, you know what? I have a family history of Parkinson's, I'm at risk for Parkinson's, and I have constipation. Talk to your doctor about it, because now is the time that maybe you can do something about it. So the symptoms of constipation often predate the symptoms of Parkinson's by over a decade.
Whoa. So what is going to alert you? Because constipation is certainly rampant in all sorts of people, not necessarily that they have Parkinson's.
It's like if you're watching and you're constipated, it doesn't mean you're going to get Parkinson's.
No, I'm just saying,
not the message.
What is going to trigger you as a gastroenterologist to start asking those questions?
Ask them, hey, do you have a family history of Parkinson's? Do you have any problems with movement? Do you see anything that's alerting you? And I would also tell them, let's see if we can treat the constipation, also high alert for any changes in a tremor, any slowness of movement. Check your families and see if anybody's got Parkinson's, because there are genetic factors. Remember, in Alzheimer's, the episode I talked about the 1-2 punch, right? The 1 punch is your genetics. The second punch is your environment and what's happening. To me, your environment's your gut, right? We think about our environment as like where you live, but the gut environment is so powerful. So that's how I would take that information and say, hey, if you're at risk for Parkinson's and you got constipation, big alert, ding, ding, ding. Bells should be ringing in your head as a patient and your physicians to say, hey, should we do something about it? And that's what we'll talk about. Like, what can you actually do, right?
That's right. And have we discussed at length of everything you wanted to talk about with the microbiome with the Parkinson's patient?
Well, that's part of what you can do, right? And we kind of alluded to that if we can get a little bit more specific. But I'll go back, and I think Margaret's a great example. I still think the 5 pillars are tremendous in this, right? So I'll talk about Margaret. Margaret's super active in the Michael J. Fox Foundation for Parkinson's, and that's a community.
It sure is. That's a tribe.
Huge. And so we talk about that's one of our 5 pillars. In diseases like this, it doesn't always make the disease go away, but it clearly controls it.
Community is so important to not feel alone.
100%.
And to get answers.
And if you have a disease of inflammation, a disease of unabated, unopposed inflammation, where, the inflammation's like out of control, it's not responding to anything reasonably. If you have a community and you decrease some of that unrest, you decrease inflammation. So you're actually helping the condition. I think diet is huge again here, right? So you want to be able to not only just talk about feeding your microbiome, which is super important. But you need fiber and water to help with that constipation, to help with your symptoms, because the majority of people with Parkinson's have constipation. We talked about one of the reasons why, because your enteric nervous system is damaged. But some of the medicines you use now for Parkinson's also change your bowel movements. And so it's really important. High fiber hydration is critical.
Oh, you're
critical.
such a proponent of hydration.
64 ounces.
So many different benefits.
Yeah, and I think that what I do is, and if you're watching, it's an easy trick. Before you leave the house, before you do anything, get 32 ounces. You know, those Stanleys or
Yes.
Yetis or those big giant
Yes.
things. Just drink it like it's medicine. Drink water, not a bunch of,
Yeah, chug it down. This
Yeah.
has literally changed my life. I've started doing this. I notice so many different benefits. I'm fuller in the morning. I feel like, more energy. I feel like my hair and skin and nails and skin is so much more hydrated. And I just feel so much better because I used to start the day with like 2 or 3 cups of coffee.
Yeah, it's huge. I mean, hydration will clearly help your skin. People talk about all this crap that they do, but hydration will be the number one factor to help you with your skin. But for Parkinson's, it's important to get hydration. And then I believe to get fermented foods as much as possible to change the equation, to get less inflammation out of your body and having your gut microbiome not create inflammation, which then create these misshapen proteins and then lead to Lewy bodies. So I think that doing that is critically important.
And the fermented foods don't have to be painful. We've talked about this. Your favorite's yogurt.
I love
Mine's
yogurt.
cottage cheese.
I love sauerkraut. I like kombucha. I'll tell you, my staff, I mean, some of my nurse anesthetists, they love kombucha.
Kombucha.
Oh yeah, they go to Costco and they get their giant
Kombucha.
case of it, and it can taste delicious. And we talked about tepache on our last episode. So you can get fermented foods in multiple forms and incorporate it into your food so that it's not like a chore, like I've got to have fermented foods. It's really about putting it as part of your normal diet. And then movement is hypercritical with this disease.
Right.
You've got to not succumb to, it's hard for me to move, so I won't move. Do your best in continuing to remain mobile. It'll be critical in trying to maintain this disease at its stage that it's in and not progress. Because if you give in and say, oh, I just don't want to do it, the less you move, the worse it is. So it's important. Again, you don't want to overdo it or fall because there are fall risks, but movement is important. That pillar is super important. And again, spirituality, I think, helps with, like I talked about, unrest and decreasing inflammation and your gut microbiome and your gut wall integrity. Some of the gut microbiome, Callie, also produce these things called short chain fatty acids, SCFAs. We've talked about this briefly, but short chain fatty acids, what they do is they allow that wall. Remember I talked to you about this, guys, the one cell layer, gut wall where poop is on one side, blood is on the other. The short chain fatty acids help to maintain the
Tighten
integrity
that.
and be strong. So it's also important to produce those. What's nice is that sometimes it depends on where you are, what part of the world you're in, where you're watching from. You can find postbiotics like butyrate, Butyrate, and that's a postbiotic. You can actually take that. I'm convinced that over time, we may eventually be able to bypass, you should still get a good microbiome, we'll get good postbiotics, what these bugs produce in the form that they produce it, so that we can then introduce it into our gut and our bodies so they can get the benefits of it. You hit them with the postbiotic right away. And so why not, right? And I think that's going to be the future. Of course, you still want to do it the right way. You still want to make sure that you give enough of the microbiome the food that it needs. But if you need a quicker change, getting a postbiotic, and they're starting to get that now.
Oh my gosh, and that's great. And I know you spent a lot of time putting together your supplement that you created.
Yeah, and I think that
probiotic.
And I think it's important. Now, the process we went through was we made sure that we believe that making it in the U.S. is important, because if you make it outside the U.S., you don't really have control over a lot of the regulations in that country. The second thing is I wanted to make sure the ingredients were pure, because people ask me, and I think I forget who asked me this morning, but they said, how do I know if the products actually work, right? And I wanted to make sure that it was in a factory that we know that the ingredients are sourced appropriately, so they're actually going to be effective. That when they tell you that it's going to be 10 billion CFUs, colony functioning units, that it's the CFUs are the number that they're talking about, right? So you have to know all those things. So we created it, took a year because we wanted to make sure it's manufactured correctly, that it is what it's supposed to be. And also we put an adaptogen called ashwagandha because it also helps with people with brain dysfunction, also people who don't have brain dysfunction. It helps you to be able to get optimize your brain function, reduce anxiety. So it was a game changer.
Yeah, you worked really, really hard on it.
Yeah,
and I will tell you that I thought I was regular before Mindbiotic, but let me just tell you, you could tell literally the first day. I was like, okay, this is complete.
and she personal experience, she goes in there more often and it's in and out.
Yeah, it's great.
You're not doing your reading that you normally
That's
would
right. Do. No, yeah, right. It's like, oh, gotta go. Done.
That's what, and so that's the benefit of the pre and probiotics right away. Mm-hmm. And then you can also get, to me, the ashwagandha and the central nervous system or the brain effects are great. That's why it's called Mindbiotic.
I love it. What about lifestyle changes? What do we need to talk about with Parkinson's and lifestyle changes?
Yeah, and I talked about that a little bit with Margaret about using the 5 pillars. What's super cool about Parkinson's, I call it super cool because I'm a little bit of a science geek, is that you could actually use something called the glymphatic system. Glymphatic system. Again, we didn't learn about this in medical school. And this goes back, like if you don't keep up, I mean, the world will just pass you by and you're like, you don't even know this exists. So the glymphatic system is a system next to the blood vessels in the brain that actually help to remove wastes, remove particles, remove like little proteins that are not supposed to be in the brain. It was just discovered in the last decade again. And even now, lots of people have never even heard about it. And why is that important? Because we're talking about a disease, right, that has inflammation in the brain. If your glymphatic system, and I discuss it in my book as well in the Parkinson's chapter, I believe, the Heal Your Gut, Save Your Brain book, and the glymphatic system helps to get rid of those solutes. Why is that important? Because if you don't get rid of them, then they can be what? Sources of inflammation, sources of where your body's immune system, your microglia, the little cells, the patrolling police officers, I call them, or your patrolling army, comes in and gets rid of stuff and makes sure that the brain is safe. So the glymphatic system is super important in clearing out those toxins.
And how do you help benefit your glymphatic
Something
systems?
that I don't do well enough, sleep. Mm-hmm. We now know the glymphatic system is active in the slow sleep stage. So it's important to get, and that's why, people like LeBron, I got to get my sleep. You talk to people that are successful. One of the things that they now understand is sleep is so important.
When are you going to take this advice, Dr.
Yeah, I'm doing it. I'm doing better than I did before. But, last night wasn't a good night. But, but other nights I'm getting better and better at it. But back to the glymphatic system, that it's more active during the night. And now we're seeing that there's a tendency, if you lie on your side, you may be able to be able to actually activate it even more, the glymphatic system. It's just fascinating to me, simple things that you can do. So again, you're asking what lifestyle changes you can make. Reduce your stress factors by meditation, by community. Also get sleep. And sleep doesn't mean that you're looking at your phone 1 minute before you go to bed.
That's right.
All of us are guilty of it because, man, once you get in those social media apps, like especially TikTok, you go down that rabbit hole and 1 hour later, you're like, oh my gosh. Right. So don't do that before you go to sleep.
You get in all the sports. It's like this athlete, that athlete.
Yeah, I
this
love
is
the
what
sports.
they said.
All of us have something,
They
right?
were talking smack to one another, whatever it is.
Right. More like the statistics and what they did and historical stuff. And all of us do it. We all have our interests, but it's not the right time. So before you go to sleep, get in a sleep hygiene routine. That means try to go in a darker room, cooler than normal, and then try to make it the same time every day. If you can make it a habit, it'll work. So if you can't sleep well, there are sleep doctors, right? Remember, we haven't talked about this on this episode or previous episodes. I have sleep apnea. For years, I didn't know that I had this, and I was literally waking up 231 times a night.
I didn't know either because I am such a sleeper that I literally never heard you wake up.
I was up north.
Anything.
I was up north with her family,
and we were kind of all co-sleeping.
And then I woke up because somebody said, well, he's not breathing. I said, who? Who is it? Because I was ready to do CPR or something. And they said, you. And I said, oh, shoot. And then, then I got a sleep study and it was 231.
Thank God. How many years would that have been? Had we not had that co-sleeping
72% oxygen saturation. Again, we're talking about Parkinson's, but I'll tell you, one of the leading causes of stroke, heart attacks that people don't know about. Because imagine, if you're not getting enough oxygen to your tissues, what happens? They die. When your heart doesn't get enough blood or oxygen, it dies. It's called a heart attack. If your brain doesn't get enough oxygen, it has a brain attack or a stroke. So it's critical if you have somebody you love that not only just snores, but they stop breathing during the night. That's not normal. And it's not just, that's just how he is. It can be a cause of a stroke, a heart attack, or other diseases of even inflammation. So I'm so glad I'm treated. But sleep is super important for this disease. So that's a lifestyle factor that not only helps your general health and decrease stress, but helps your glymphatic system, which I love.
So let's talk recipes and different foods that we can be eating. And I know we're going to go in the kitchen a little bit.
Yeah, I think that, again, it's like a broken record, right? If you can eat, again, foods that are high in fiber, and what are some of your favorite foods that you like that's high in fiber? Because I always give my choices. What
Broccoli,
do you like? Broccoli, cauliflower, cruciferous vegetables, right? And fruits. So if you can pick a variety, again, it's the same. It's really the same formula, but you can make it delicious.
I like chia seeds.
Yeah,
we add those now to our yogurt, just so we get that little bit of fiber.
Omega-3s and fiber and omega-3 acids as well. So I think all of those anti-inflammatories will be able to help you. And then again, try not to go out to eat at least at the most once a week if you can.
We're going to dig deep into that one in the next episode because she's almighty. There's a lot to talk about.
And there's ways you can people say, well, I don't have time. I work too much or whatever it is, right? But it's important because you don't know what's going in your body. And we're telling you all this stuff about how your gut is getting inflamed. The diet and what you eat is super important, especially if you know that your entire microbiome, its existence is dependent on you. So what you put in your body will determine whether it's going to be a pro-inflammatory state or not.
Next up, we are going to head to the kitchen
and
make some Indian dal, which we literally eat every single day. But it's so great when you eat it every day because you know your kids are getting that protein and they're getting that. It's amazing. So we would just have it every single day.
More fiber that's feeding their microbiome. It's never too young. Our youngest, Rocky, he is 4. And we know that if we can shape his microbiome now, you'll probably set him up for a great microbiome for his life. Imagine the microbiome
maybe by
that
the time he gets to his upper ages, the back 9 of his life, there'll be more treatments for Alzheimer's, Parkinson's.
100%. But even that, right?
Stroke.
Let's say if he has the right microbiome that we're helping him create, it's kind of like having a great orchestra for life. And then what it plays, right? The orchestra of the microbiome, what it plays, meaning the products, will be dependent on what you give it. So the analogy is this, right? The broccoli is a wonderful symphony that you're giving the orchestra to play. It's like, la, 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 and then you give them, it's nice. But if you give them a horrible piece of music, it's like discordant. Part of the horn sections playing when they're not supposed to.
Mm-hmm. It's not in harmony.
And that is a pepperoni pizza every day.
Yep.
That is a cheeseburger with fries, and don't forget to add the big chocolate shake and supersize it, right? That's the bad cheat that you give your microbiome, your orchestra, so they produce horrible products. So the analogy for the orchestra is horrible music. The analogy for the microbiome is horrible postbiotics, wrong concentrations of the hormones that it produces, so your behavior is erratic. You don't find joy in your life. Depression, anxiety, eczema, autoimmune conditions. Sound familiar? Increased rates of cancer, increased rates of neurodegenerative disease. And that's what the orchestra is producing. But you can set them up for the right orchestra, the right microbiome at this age.
Yeah.
And they proliferate. And, research has shown that it can continue on. You can preserve that microbiome. And then if you feed it correctly, it'll serve you for life. To me, it's so powerful because you've got your own internal army that's going to help you to preserve health. And that's what we're doing with him, trying to convince him that when he's going down the aisle in the
candy
in the grocery
goodness,
store,
yes.
I want that cotton candy. And you explain to him, I tell him that your brain is going to hate you for it.
Yeah, we tell him.
Yeah, he wants to be a gymnast, right? He goes, I want to do gymnastics. Well, you can't perform optimally if you got cotton candy and empty calories, that you're feeding your good bacteria that can turn into the bad microbiome. And this is the age, so you can do it. It's hard with kids because it's easier just to give them that piece of candy. It's like anything else. You have to do less work. They don't complain.
We see all the time as they get older, well, Baba, what do you think? Should I eat that? Is that not healthy? Or I feel bad. Yesterday I had, we had ice cream. We need to go a few days without it. Do
you remember July 4th? So I do the health news for the ABC.
Oh yeah, this
ABC
was a little bit embarrassing.
ABC affiliate in Detroit, and so we go to the July 4th. This is July 4th.
It was the car show.
Oh yeah, the Woodward Cruise.
Woodward Dream Cruise.
So the Woodward Dream Cruise, right? It's this amazing event we love in Detroit, where all kinds of classic cars and funky cars go down Woodward Avenue, which we did a fact check. It's the first paved road in the world. So then we go there, and the head of the station sees Sean. And at that time, I think he was like 6.
It's a couple years
ago. He's like, here you go. Here's some, it's a cheeseburger and chicken fingers and fries. And he looks up at the station head, and he said, we don't eat that kind of stuff in our house. And the guy goes, okay.
He's like, okay,
salad perhaps.
Here's some melon.
Yeah, listen, you don't want to be that extreme because you want to make sure that they can eat those things once in a while.
Yeah.
But the concept is this. Their biggest role model, their biggest heroes for kids.
That's right.
You are their biggest hero. You're their biggest role model because they see you, and what you do is what they'll emulate. So you can't tell them to do well and then have those tater tots with, drizzled cheese and stuff all the time. It's just not going to work.
All right, so we're back in the kitchen, and now we're talking about lentils, which is something we eat every single day with our kids.
Our kids eat dal, which is another word for this lentil dish, which is kind of a soup. It's dal, Indian dal. Our kids literally eat it every day. Our 4-year-old does, our 10-year-old does, our 12-year-old, and we love it. So this is great
because they're getting their protein. They're getting
100%. The red lentils that you're gonna show them, hopefully. Yeah. And I think, go ahead. You want to go through the recipe and I can keep talking?
Yeah, so first we're going to put a little bit of olive oil in.
Olive oil to me is the healthiest oil you can have. It's great for gut health. We know that it's fantastic for overall cardiovascular health too. So we love using that. And this you just heat this for a little bit, then you add
the cumin seeds. Now the thing about the cumin seeds, you want them to kind of sizzle a little bit. I'm going to turn this up. You want them to kind of pop and sizzle so that they release their aromatic flavors. Same with the bay leaf. So we'll add a bay leaf.
Yeah, it doesn't quite have the same flavor if you don't heat up the cumin. So it's important to heat that up.
My mother-in-law and sister-in-law taught me.
Oh yeah, I know very well.
This is cumin and curry.
And so this is so important to talk about with Parkinson's because curry powder has turmeric, cumin, and coriander. All of these are anti-inflammatory for the gut and for the brain. So it's important. It's going to be delicious. You'll see if you make this at home, but it also is such an important factor. And if talked about neurological diseases in countries like India, when they use these spices, it's much lower than the Western world. So this is a great addition to our armamentarium. So we talk about food as medicine, right? We talk about instead of getting one more pill for helping with whatever disease state, let's use turmeric instead. As kids, we knew that turmeric and cumin were amazing, had medicinal properties. Even as a kid, I knew that. And
The Indians have it right now.
well, we talked about this, right? It's like when I was a kid, we were kind of already had a head start because we knew about these anti-inflammatory properties of cumin and turmeric. And it wasn't just me, it was everybody in the community that did this. And that's why perhaps we have lower incidence of Alzheimer's and neurodegenerative diseases in India. But go ahead.
And then this is garam masala and turmeric. Two other amazing ingredients here, and we'll let that saute for just a second, and we'll add our onions. Just dice it right.
And we love onion for gut health because it has prebiotics. Remember, that's the food, right, for the gut bugs. So I love onions on everything, and I know that a lot of you love onions on everything. So when you take onions, especially if they're raw, they're great food for all these good bugs. So what we're doing is cooking them and cooking them until they're a little translucent, and then we're gonna after that we're gonna add the red lentils and the salt. So the red lentils, and you talked about this for our kids. We love it because it is a great source of protein. Because lots of folks, right? Lots of my patients say, well, doc, I cannot go, plant-based or non-meat because I can't get protein. This has a ton of protein in it. It's also low in fat. It has vitamin Bs, multiple vitamins, including vitamin B, and I think it's a great source of nutrition, and we do it every single day. And it's not heavy. So sometimes you take these dishes and they fill you up. This is not one of them. It's fulfilling and it's nutritious, but it doesn't make you bloated or uncomfortable. I mean, remember when we first started dating and you learned about dal, what did you think about it?
Oh my
gosh. What were your thoughts?
What do you mean? I thought it was great. What do you mean? One thing I did feel like I learned, it was a real eureka moment that I was like, oh, this is going to make me sound so ignorant.
It will not. It's okay. It's a lot of people think that.
In a town of 10,000 Caucasian people, you don't think about how other areas of the world are being raised on lentils and how delicious and healthy that is. And not to knock America, but a lot of American children tend to be raised on things like noodles or
mashed potatoes with gravy.
Mashed potatoes, or of course they also do peas and corn and all those other things too. But this is a kind of a different way to get the great proteins. And so I was actually really excited that our kids could be, eating it every single day. I mean, literally every day.
And the other thing is, people who are not familiar with dal or lentils think this is a big source of carbs. So remember, not all carbs are made the same. This is carbohydrates that are complex because it has fiber. So remember,
we get that sugar spike that
exactly. So the glycemic index is not as high as, for example, simple carbohydrates. So what I mean by that is carbohydrates that get absorbed and then immediately cause a sugar spike, insulin spike, and that causes insulin resistance. This is different because when it's surrounded by fiber, the absorption is slow and the nutrients, including the carbohydrates, get there slowly. And that's a key difference. And the amount of protein that this has. This sustains a huge portion of India. Lots of people, this may be the only meal they get, which is dal and maybe some vegetables. So it's an incredible meal. And I think it's great for Parkinson's because it gives you the nutrients you need and the anti-inflammatory products and gut health with the prebiotics and the fiber. So
I'm actually going to wash these lentils real quick because my mother-in-law and sister-in-law really taught me about washing them. So typically we wash them, we just kind of rinse them out 2 or 3 times. Just kind of get some of the extra stuff out. Make sure it's all good.
It's clean, then you put it in there.
We do the same with our rice. And then we'll just add this in. I'm going to get rid of some of this more water. Add this in, and then we'll add our 4 cups. This is 1 cup of lentils. My sister-in-law also taught me that red lentils, this is like an Indian thing, are the only lentils you can really use with onions. The other lentils don't call for onions, right, Partha?
That's right. I love onion with dal.
We do love onion.
It's since I've been a kid, I loved it.
And I added a little salt while you were chatting away. That's probably enough water
enough for now.
So then we'll let this kind of boil for, half hour, 45 minutes or something, like you would any other.
And with the magic of television, we have voila.
That's right.
We have
some finish. Ready? Voila. Yes. We have some finish right here. There we go. So it can look something like this.
Yeah.
Yeah.
This looks amazing.
Yeah.
And
so we eat this pretty much every
so you
single
can
day.
you can
see the
use
cumin
it
seeds there.
if it's winter, and we're in the Midwest, it's winter. It's a great warm dish for us to have. You can have it over rice like we do. You can have it plain if you want to. We eat it all year round, but it's a great fall winter soup, but we use it all the time. To me it's a great addition to the armamentarium, for fighting Parkinson's and
we just have
preventing
it
it.
as a side dish. So
Yeah, but for brain health and gut health, it's an absolute must to me. And we'll be back and talk more about Parkinson's.
the other thing I wanted you to touch on, because we were talking about Rocky, our 4-year-old, and his microbiome. Tell the folks at home about breast milk.
Oh yeah, it's pretty cool. So, kids, often you nurse kids and you think you're giving them all the nutrients so they can digest it. But it turns out there are some oligosaccharides that are in the milk, that just carbohydrates in the milk that human beings cannot digest. That human beings can't digest it, but guess who can? Your microbiome. So imagine the concept that a mother in their breast milk is making food to feed the baby's microbiome. To me, that blows my mind. Because
I think that is
amazing.
mind-blowing. I mean, amazing. And God, the universe, the planet, the ethos, whatever it is, had some really smart plans, because that is fascinating. From birth, you're feeding that microbiome. I mean, that is sweet.
And this microbiome, these creatures predate us. They've been around for 15 million years, even before there were eukaryotes, which means that cells, with organisms with cells and nuclei, et cetera. And it's all these kind of technical terms. But even when they were the most primitive organisms, these bugs were there. Mm-hmm. They were there before us. They're going to be there after us.
It kind of makes you wonder again,
who's zooming who?
who?
Yeah. And are we just these lumbering creatures that feed these bugs and poop them out so they can travel everywhere? So cool. And that's it. I mean, it's a little abstract, but it tells you that our bodies are made, and even a mother's milk when you're nursing your child is made to feed the microbiome. That's how important the microbiome is for your health. And we were talking about Parkinson's. It's clear that if you have good gut health, you give yourself a chance of not having the disease, or at least decreasing the chance of having the disease. And if you have Parkinson's, it also helps ameliorate or improve your symptoms. So I think it's really an exciting time that we can talk about these diseases that are devastating, but ways to prevent and treat them.
Yeah, it's awesome. What are we talking about on the next episode?
Yeah, we're going to kind of, talk about ways in which you can incorporate gut health into your life and sum up some of the things that we talked about. So that's going to be exciting, because we'll give you some practical tips on really how to be able to hone in on your gut health and improve it.
Yeah, that sounds fun.
Boom.
Make sure you never miss an episode by following on Apple Podcasts or subscribing wherever you listen.
And if you want to learn more, get a copy of my book, also titled Heal Your Gut, Save Your Brain, available everywhere books are sold, October 1st.